Thank you. Good afternoon, everyone. So glad you could join us today for this webinar on evaluation as part of the Foundation for a Healthy Kentucky's Health for a Change training series. A little bit about the Foundation, some of our upcoming events, and then I'll turn it over to our experts from Reach Evaluation who will give us some 101 on evaluation today. First, the Foundation for a Healthy Kentucky is a nonprofit philanthropic organization created in 2001 with assets from a settlement agreement as a result of the merger between Anthem Incorporated and Kentucky Blue Cross and Blue Shield. The Foundation's mission is to address the unmet health care needs of Kentucky. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. I'm honored to have joined the Foundation in 2013 to work on the Foundation's data initiatives. Some of the projects I work on include the Kentucky Health Issues Poll, an annual poll of Kentuckians' thoughts on health policies and their own health behaviors, and that is a partnership with Interact for Health, a health foundation serving the greater Cincinnati area. I also work on the data website Kentucky Health Facts. KentuckyHealthFacts.org is celebrating its 10th year, and that was a data website that the Foundation put up in partnership with a number of groups, including the Cabinet for Health and Family Services, to get Kentucky health data easily available at the county level. Happy birthday, Kentucky Health Facts, 10 years in existence. I also work on other data initiatives like the Data Forum, which is a great event where we had a bunch of data lovers getting together talking about how we could use data and sharing data to make health improvements. And finally this project that we're doing here, Health for a Change. Health for a Change was developed in 2011 to reach out to nonprofit communities, health advocates, people just like yourself who needed different types of trainings to do their job better. So Health for a Change, we've done a great variety of trainings like grant writing, finding health data, and topics just like this one, evaluation. On that website there, healthy-ky.org, under the events page, you'll find Health for a Change. There we have the archives of our trainings and also the upcoming schedule of events. Health for a Change has served thousands of Kentuckians and reached every Kentucky county in our great Commonwealth. Here are some of the upcoming events. I'm thrilled that in August we'll have a workshop in Bowling Green, Kentucky. So folks on the call who are in Bowling Green area, please feel free to join us on a Working with the Media workshop. That'll be in person in Bowling Green August 16th. And a great webinar on August 22nd where Ben Summers from Harvard and Lynn Quincy from Altruim will talk about some of the research they've done on Kentuckians' experiences with Medicaid expansion. So that'll be a great one not to miss. We have 3 events upcoming in partnership with Interact for Health, the health foundation I mentioned. September 27th, we'll have an in-person workshop on smoke-free campaigns. That'll be held at the Northern Kentucky Health Department. October 4th will be the first of a 2-part series. First, we'll have an introductory webinar on learning how to measure your advocacy efforts. So all of you evaluation lovers that are on the call or people that may be just getting started with evaluation today, this is for you. It'll be focusing on policy and advocacy evaluation, so a very specific part of evaluation. And then the second part of that will be an in-person workshop where we're bringing in a great trainer from Innovation Network to have an in-person workshop on the 25th. That'll also be in Northern Kentucky. You can sign up for those on the registration page via our events page on Health for a Change. Finally, before I turn it over to our speakers, I wanted to remind everyone on the call that on Monday, September 24th, the Foundation for Healthy Kentucky will have its annual Howard L. Bose Memorial Health Policy Forum. And the topic is substance abuse. And only a few seats remain. So please, folks, if you're interested in getting a seat to that, take time today to register. That's at regonline.com/Bose 2018 because that event is almost sold out, and then it goes to the waiting list. So don't delay by registering for that. The team from Reach Evaluation, Ben Berksby and Teresa McGinney, are here to share their insights on evaluation. I'm very excited to have them here. Evaluation was my first step into public health. It was at an evaluation shop, so this is near and dear to my heart. And Ben and Teresa share my enthusiasm, so I'm glad you're all here today. I'm going to turn the call over to Ben and Teresa. Welcome.
Thanks so much, Rochelle.
Good afternoon, everybody. Just quickly again, I'm Ben Berkby, and I'm a licensed psychologist. and Senior Evaluation Researcher here at Reach Evaluation.
And I am Teresa McGeaney. I'm an epidemiologist, and I've been on board at Reach for about 3 years now.
We are really glad to join you today and to talk about evaluation, which is one of our favorite topics, of course. Real briefly, a little bit about our organization. We're a team of 11 people, and we come from different backgrounds and different professions, and we've been working together since 1987 to help governmental, nonprofit, for-profit, and philanthropic organizations bring about change, and to do that through the use of program evaluation. And we hope that you take away some information today that can be useful to you in your setting.
So just a brief overview of our presentation. Like Rochelle introduced us, this webinar is all about how you can use program evaluation to help you plan for success in the different programs that you all work on. So we're going to go over some definitions and kind of define program evaluation, look at different types of evaluations, a different type of evaluation activities, dispel some myths about what program evaluation is not, and really hit home why it matters and why it's important. And then quickly go through the steps of conducting an evaluation, and then we'll leave you with some resources to follow up.
So the first thing we really wanted to do is just introduce the idea that you probably do evaluation every day, but you may not think about it in that term. So whether you're picking out clothes in your closet or planning a family vacation, you're probably thinking like an evaluator might think about a program, and it's a helpful way to kind of introduce the topic. So for example, with the idea about planning a family vacation, you're probably asking yourself, well, what are we going to need, to get there? How will we get there to wherever we're going? What are we going to do? What are we hoping is going to happen on this vacation? What do we want it to be about? And then, afterwards, you probably are going to ask yourself, well, how did it go? What did it meet our expectations? And so evaluation really just combines common sense thinking with scientific and research methods to improve a service or a program or a policy. And we think that's a very helpful way to introduce evaluation, is that it's probably something that is not far out of reach for most of us. It's just not that we all do it for our career. And we hope today that you get some tools to start increasing the capacity in your own organization for evaluation. So let's just get a couple of definitions out of the way so we kind of are operating from a similar understanding. And so programs are organized efforts that have some kind of defined parameter, and sometimes you get to define them yourselves, and sometimes they're defined for you by a funder, for example. And these organized efforts use some kind of resources. Usually those are informational or technology or financial or human resources to help people or to help organizations or to help populations in some way by providing one or more services. And there are many different definitions of the word evaluation, and if you were to Google that, you would find a lot of different things. But one that seems to make sense to us and that relates well to program evaluation is that evaluation involves making a judgment of some sort about the amount, number, or value of something. And so when you put those two words together, program evaluation is really a systematic way for collecting, analyzing, and then of course making use of information that you've collected to answer questions and to make some kind of judgments about a project or a program or a policy. And the whole goal of doing this kind of an effort is to decrease the amount of uncertainty you might have about your program or your project, and to increase the amount of understanding that you have about your project. And then many of us are involved in kind of human and social service program service delivery. And so, of course, the overall goal, even beyond that, is to contribute to quality services being provided to people in need.
Okay, so we're going to define now a few different roles that come into play with evaluation. So first, you have the evaluation sponsor, which on our end is usually the client. This is the person who is wanting the evaluation done. It might be the funder, it might be the actual person who is doing the program, or it might be both. Then you've got other stakeholders who are other folks who have a vested interest in the program. They might be funding it, they might be the ones who are on the ground every day running this program, they might be folks who are benefiting from the program or receiving services through it, and they might be the community at large. These folks are important to think of because they would all be impacted depending on the outcome of the evaluation. So if you figure out that something is really having a great benefit to the community, then that's important for the community to know. Likewise, if you find out that something's not having the impact and it's not the best use of resources, that's important for both the community as well as the funders and everybody else in between to know. Finally, this is probably obvious, you've got the one who's doing the evaluation work. So they are responsible for designing and conducting and reporting the evaluation. So they've got the expertise to do all of that. In terms of evaluators, there are really two different kinds. One is an internal evaluator, and this is somebody who works for the organization who is trying to do the evaluation. They can sometimes be, somebody who's already in the organization. I know that city governments and large health departments might have somebody on board whose job it is to do kind of quality improvement and internal evaluation work. Some pros for an internal evaluator is that they're very likely to be more familiar with the organization and possibly the programs, and they're likely to be committed to the success of both. A con is that they might be subject to internal pressure and bias, and even if this person is an objective person, the results that can come from internal evaluations can be perceived by others outside of the organization as less rigorous or more subject to bias. The other type of evaluator is an external evaluator or a consultant. So this is somebody just who comes from an outside organization to help you out with evaluation. And this is kind of the inverse of the last. They're more likely to be objective and more likely to be perceived by others as objective. But they might be less familiar with the program, and so there might be a little bit of a learning curve, and they may not be as committed to the program's success. So we're going to take a quick break just to kind of break up the presentation and ask if anybody's got questions so far.
It looks like we have one question that came in through the chat function, and the question was, will you have access to these slides? And the answer is yes, you will. So if you're trying to furiously write down notes, no need. You will get access to the slide deck later. And then, go ahead.
We had another question that came in about internal versus external evaluators. And when do you know when you need to hire an evaluator versus when you can do it yourself? Ben, do you want to take that one?
Sure, and that's a great question, sort of how do we know if we need an internal or an external evaluator? And the answer, it depends on your situation, but if the effort you're undertaking is likely to be under scrutiny, or it's going to probably be judged by others from outside your organization, or if you're trying to build an evidence base or stake a claim with your service or your project, so to speak, then you probably want to consider working with an external evaluator. One, because of that perceived objectivity that Teresa mentioned a moment ago, and then also because of the amount of expertise and experience that an external person is likely to have to help you with those particular efforts. It's also the case that sometimes the answer is given to you by your funder. We do a lot of work with entities that receive federal grant dollars, for example, and many of those federal grants have a requirement for an external evaluator. However, if you're just curious about your program and you want to improve on your internal service delivery or the processes in your organization, and you have somebody in your organization who has an interest or a willingness or maybe some expertise with data or maybe Excel, for example, you can certainly take on some internal evaluation activities on your own. So I think it depends on the scope of what you're trying to do, if it's going to be judged by others outside of your organization. Whether it's required or not, of course, would be an important factor to consider. And then one other quick thing, some organizations hire and have folks on board who are internal evaluators, and they do that work regularly. And so, but that's not a luxury that many organizations or companies have. And so I think it's perfectly legitimate for you to take on some evaluation activities, even if you don't feel you're an expert or you can't hire someone at a full salary to do that. And we're hoping that through the rest of this presentation, you'll get some idea for how you can go about doing that.
All right. We want to talk about some different types of evaluations because there are a number, and we're going to go over 4 today. So the first is an evaluation of need. This is often called a needs assessment, and I bet a lot of you on the phone have done them before. This goes hand in hand with program planning. A lot of times it's required. I know that health departments have to do the MAP process, which is a form of a needs assessment every few years. Hospitals have to do them. FQHCs have to do them. A number of organizations, need to do them regularly. So the process is just to identify and measure the level of unmet needs within an organization or a community so that you can fill those through your program. So it's a basic first step before effective planning can begin. The next type of evaluation we're going to cover is an evaluation of implementation or process. So this is determining, whether your program has taken place, has been implemented as you had planned or as you had expected. It's about documenting the procedures and activities that have been undertaken in service delivery and then comparing them to what you said you would do, and then kind of exploring the reasons why or why not you may have been successful or not successful in meeting those goals.
And I was going to make one quick comment, Teresa. So the reason that a needs assessment is so important is that you might have a great program or be aware of another program that's operating that's perceived very well, and you might be excited about implementing that, but you want to make sure that there's actually a need for it before you launch in, because it could be a colossal waste of your resources. And then with implementation and process evaluation, although it may not sound terribly exciting, it's really actually quite important because if you don't have good information to kind of document how your implementation went or how implementation is going, then you're in not a very good position later to either associate what you did with the outcomes that are achieved, or to take credit, for example, when things are going well, or to really know if the outcomes were not what you hoped for, what went wrong. So it's important to have this piece of information because it's going to be very useful for making course corrections and program improvement, but it's also very important later when you want to kind of see, did our program have any contribution to the outcomes that we noticed later? And so it's very important to collect this type of information.
Definitely, great point. And we're going to go through now a couple examples of these types of evaluations so that you can have some kind of real-world examples so that you can see the real benefit of these different types of evaluations. So this first one, we were working with a client, and they were applying for a big grant that would address youth behavioral health, which encompasses substance use as well as some mental health issues, including suicide. The funder for this grant had really encouraged folks to look at military populations. And so we knew that, veterans were at an increased risk, and active duty military were at an increased risk for suicide as well as substance use. But something that we didn't know was about, the rest of their families. And we had this very large, we continue to have this very large survey called the KIPP survey, if you're not familiar with it. It's a statewide survey of middle and high school students across Kentucky. You can find out more information at kippsurvey.com. So we had this great survey, and so we added a question on asking the students whether they had any connection to the military. And what we found was that these students who did have military connections, this graph shows it broken down by the yellow bar is those who did not have any military connections. This middle green bar is those who had one, and then this one is those who had two or more. We found a stair-step pattern of risk associated with more connections to the military for these students in terms of their suicidal risk as well as their substance use. So this was a great example of a needs assessment where we found a vulnerable population that we really didn't know about before. So the client ended up writing the entire grant targeting this population because we had discovered this important population who had a need for services. So the next example is one of implementation or process, and this is an ongoing project. But this is a school-based intervention that they were doing, working with youth to improve resiliency skills. So they had an initial goal of training over 100 schools in the first year of this program, and they had the funding to do it, and they were all set to go and everything. But in implementation, they ran into a number of barriers. This was the first time they had tried to implement this particular program, and so they did find some barriers in recruiting schools just because schools have so many other programs going, and there are just limitations on their end. And then they also found that there were a limited number of actual trainers. So they had been flying in national trainers to do this training to all the different schools, but they realized that they couldn't, hog them all in Kentucky. These national trainers had to go other places. So these are some of the barriers that they learned along the way. And the reality is they'll probably end up training about 60 to 70 schools, which is still great. But this implementation evaluation is still ongoing, but this is the information that we've received so far, and then we're also going to supplement it with we're going to go back to the actual schools and the folks who were trained and ask them what went well, what didn't go well, what were your barriers in participating, to kind of flesh out that story a little bit more. And all of this information will be very useful to them because they will have to make some tough decisions after the grant is over on whether to continue this program, whether to expand it, whether to, adjust it and try different things. So all of these lessons will be very useful.
Okay, thanks, Teresa. Two other types of evaluations that we wanted to talk with you about that are common are outcome evaluations and efficiency evaluations, which are also sometimes called cost effectiveness or cost efficiency evaluations. And outcome evaluations are something that you really want to do once your program has been operating for a while. So this is not something that you do at the beginning of your program. Your program needs to kind of have been established and being implemented at least for a little while to where that there's a sense of stability in operation. But outcome evaluations kind of focus on questions around, did our program contribute or cause the outcomes or the intended effect that we were hoping to get from the work that we're doing? What are the data? Are they positive? Many projects and programs have shorter term and longer term goals and objectives along the way to achieving end outcomes, and these types of evaluations focus on looking at those things. And then it's important to know that different stakeholders may have different ideas or needs about which outcomes are important. So a funder might have a different idea of what's an important outcome versus a client recipient who might be concerned with a different element of outcome versus the program staff or program managers who have to make decisions about the program. And so it's important to kind of, as we mentioned earlier, wrap in these stakeholders, and we'll actually talk about that in a little bit, because sometimes the outcomes are different depending upon who you are and your role in the program. One other thing that outcome evaluations will do is often look at levels of service or dosage, so paying attention to how much of a service or how much of a group of services people got, and looking to see if that makes any kind of a difference in an outcome. Efficiency evaluations really are best done when a program is at a level of maturity and it's been operating for quite some time, and we need to really take a deep look at, okay, we've been doing this program for 5 or 10 years. We have a lot of data about how much it cost and what was delivered and how well it went. Now we need to find out if this thing is worth it or not, given the cost and what we know. So this type of evaluation looks at costs and benefits and kind of frames the approach with, knowing what we know now, was this a wise use of the resources that we had? Was there duplication with other things that we could have, that we didn't know about, that could have saved us some effort? Are we really wasting our efforts by doing this? And, unfortunately, sometimes very successful programs may not be the most efficient ones. And that's important to know, because when decision makers have to make very tough decisions, which is what often has to happen, sometimes a program that is 80% successful is actually a better use of your money than a program that is 100% successful but costs 3 times as much. And so these are the types of questions that an efficiency evaluation would look at. Now we want to give you a couple of real examples of evaluations that we've worked on that relate to both of those. And the first one is related to a tutoring program that was embedded within a much larger place-based initiative that took place over 5 or 6 years in some counties in Kentucky. And it had a wide variety of things happening to improve student outcomes in an educational pipeline. But one of the central features of the work was identifying students who were at risk for not being proficient in math or reading, and then wrapping a set of services around those identified students to see if they could improve the situation for those students so that they could become proficient in these areas instead of being on the bubble or at risk or underperforming. And so in this outcome evaluation, we looked at students who had received both math and reading tutoring, and we found that those who did receive these services were more likely to improve, but that they needed to have at least 6 or more of these tutoring sessions in order to really see the benefit. And so that kind of relates to that dosage question that I was talking about earlier. And it was kind of an important finding and very, very useful to our client, because as they are moving forward with their work or they're expanding their effort, it's very helpful for them to know that when we offer this type of a service, we probably need to have a dosage at a certain level in order to get the impact that we really want. So that's an example of an outcome evaluation. And then it's been some time ago, and this graphic sort of implies that it was just a very simple and straightforward project, which it was not. But we did look at a voluntary home visiting program for new and expectant parents that had been sponsored by our state government and had been in operation for some time, which was part of a larger effort. And we did a cost-benefit analysis to look at, for every dollar that was invested in this project or this part of the project, what can we say about how much may have been saved in the future by costs averted? And that's a particular way of doing a cost-benefit or a cost analysis. And in this particular case, for this particular program, the results were quite nice and mirrored those that were shown in other similar projects around the nation. and we were able to look at what was available over that period of time and kind of arrive at the conclusion that for every dollar invested by the project, it probably returned about $8 in savings later. And so that's very useful information for decision makers to have.
Okay, to kind of recap on the 4 different types of evaluations we've just gone over, this will be a handy slide for you to reference back to. So at the top of this chart, we have the type of evaluation, and then we have the main question that's being asked below that, and then the program stage. So this kind of touches on what Ben was saying before, that you'll want to do a needs assessment before the program even begins to figure out what program is needed, what type of program is needed. While you are implementing and while the program is young and you're working out the kinks, you should do a process and implementation evaluation. Once you've got the kinks figured out and you've got, you know that School A is delivering the program in the same way as School B, that's when you can move on to an outcome evaluation. And so that's for an established program to see if it's having the, impacting the outcomes that you want. And then once you find that it is hopefully impacting those outcomes, that's when you can look at really the efficiency of it, the cost efficiency. So that's for a more mature program.
So we also thought it's important to just talk about the misconceptions about program evaluation that are quite common and that we've heard before, and we want to just talk through some of the most common ones that we are aware of. And sometimes people have had a negative experience with program evaluation or a particular evaluator, and they are a bit suspicious of program evaluation, and perhaps rightly so. And we really want to dispel some of these things. And really we view evaluation as a very collaborative effort. It has to be led by the data, and the data tell you where we go, but it doesn't have to be a negative experience. So one thing that's important to know is that program evaluation is not the same thing as basic, traditional, or laboratory research. While it's true that some of the methods used might be the same, usually there are differences in terms of the audience. So when you're conducting basic research, you're kind of, writing to a broader field and making a contribution to a field of study. You're probably going to be publishing your results in a peer-reviewed journal. Whereas with program evaluation, your audience is going to be your stakeholders. And there may be more than one audience, but your audience is going to be much smaller and it's much more customized. And then in program evaluation, you're also you don't have the luxury often of having a lot of control like you might in highly rigorous and laboratory-based or randomized control studies. These sometimes happen for program evaluation, and they're wonderful when they do. But in the real world, programs are based in communities and run by people that have multiple influences, and they're very complex, and so they're messy. And it's hard to have the same level of control that you might have in a laboratory or in a very constrained research project. But they do share some methods. Program evaluation is not an assessment of any individual. So again, the program is the subject, not an individual within a program. Although program evaluation certainly gathers information from people and may include gathering information directly from some individuals, they are not the unit of analysis, so to speak. And the information collected is aggregated and combined to tell a story of the program as a whole. And so it's not really there to kind of point out or emerge problems with any individual, although people are certainly important to the contribution of information. It's not a program audit either. Program audits are usually much more concerned with compliance and meeting regulatory or accreditation type standards. And while that can be important and maybe even be a part of a program evaluation, that's certainly not the main focus of a program evaluation. And then evaluation is not aimed at proving or trying to make sweeping decisions that a program is either a success or a failure. Now, in very rare cases, when programs have been implemented for a long time and there are big stakes at risk, sometimes there are evaluations done that determine if a project will continue or not, but that is the minority. The majority of program evaluations are about creating information so that program managers and decision makers can make adjustments and focus on continually improving what they do. So the idea here is that no program is perfect. Implementation is never smooth and even. It's often bumpy. There are often, things that happen that were unexpected. This is all normal. But success with the program is really achieved through continuous feedback and learning, and the only way to do that is to gather information about how it's going. And that's kind of how we approach all of our evaluation work, is one of continual learning and not sort of making a final good or bad judgment. The other thing that evaluation is not is a highly complex thing that is done in one way only by an outside expert. The idea here is that an evaluation should really fit the program that they're trying to serve, and they should fit the information needs of the program managers and funders to make sure that the information being collected is what they need to know to make decisions about current program issues and needs. Now, we think it's very important, and it's a good thing to do for program managers and funders to commit and make a strong commitment to gathering information about what they're doing so they can learn what's really happening and how it's really going and make changes to improve. But this can be done in many different ways. An evaluation could take 100 different directions, but at the end of the day, it should really be meeting the need of that program or that set of programs. So then, why is evaluation important anyway? And there can be some criticisms that come up about evaluation, like it takes time, it might be expensive, we already know what we're doing is working, and those are common things that we hear. But it's important to kind of talk about the main reasons why we think evaluation is really important for a program. And number one is that you just want to make sure that what you're going for is actually happening. So are your program objectives and goals actually being met? And if they are, great. Why is that happening? What can you learn about what's working well so you can facilitate that or use it as a catalyst to make even more improvements? If things are not going the way you had planned in terms of short-term or middle-term achievements, then you also want to know why so you can make course corrections. So you need to identify what's working well, what is not, and then this is where program evaluation is particularly important and different from other types of investigation efforts like performance management. Program evaluation really seeks to understand the why. Why are we seeing what we're seeing? What can we learn about what's happening, and what can we try to attribute that to? And that's a different level of understanding than gathering some information about process metrics over time.
Another thing that I wanted to jump in with, which builds off of one of the questions that we got about how can you convince people who aren't on board with evaluation of its merits and of its value. Program evaluation will give you information to share with others about the program. So if it's going well, you can have data to say and testimonials and that type of thing to say to your leadership, to say to legislators, to say to funders when you're applying for a grant application, this program works and we have the data to show it. So that's one huge asset that I see in program evaluation. And again, kind of building off of what Ben has been saying, if it doesn't work, you have some concrete information to guide your decisions on, whether you want to continue doing this or whether you want to head in a different direction.
Yeah, those are great points, Teresa. Thank you. And then, later on, you want to be kind of having some idea of, look, if all the resources that we're allocating to this effort, are they really getting us what we need or not? And to what degree is that happening? You really need to know that because you want to make the best use of your resources. And then just, sometimes evaluation is important because it's required, which often happens with funders, and this seems to be happening more and more, even within private and philanthropic organizations who may grant you money. They want you to do an evaluation. And there are many other reasons why evaluation is important, but most people who are working in programs and delivering services to help the human condition care a lot about wanting to do a good job and actually delivering quality services to people in need. And what you don't want to do is be doing things that aren't helping, or even worse, that might be harming, which sometimes is uncovered in an evaluation. And so if you really just view evaluation as a program improvement tool and aid, I think that can alleviate a lot of the discomfort that some people feel about evaluation. One other quick thing I'll say is that sometimes you hear that it costs too much money or it's going to take time away from our service delivery, and I think those are legitimate concerns that people might have. And one thing I'll tell you is kind of an anecdotal rule of thumb that you might hear in our field, which is 20% of the effort in evaluation can often give you 80% of what you need to know. So even making small inroads into gathering information and thinking about evaluation with your organization can often give you a lot of information without a huge expenditure of your resources, of your staff. And so I think that's worth mentioning. It can be done in a way that fits in with your organization.
So now we're going to quickly go through the basic steps in conducting an evaluation. And so this is an overview real quick of the basic steps. First, you want to identify the stakeholders and develop an evaluation plan. Number 2, describe the program. 3, develop evaluation questions. 4, collect information. 5, analyze and interpret that information. And then 6, develop a report.
And I'm not going to read this slide out to you, but the first step is about identifying stakeholders, and we kind of talked about that before, and this slide just repeats some of that information. I do want to say, though, that the bottom bullet point I think we feel is really the most important at this stage of an evaluation, and this is to clarify all of the expectations at the outset so that there's not a problem later on, especially if the results are not sunny, or even if they are what you wanted. So making sure that both on the evaluator side and the program side and the funder side, everyone has a shared understanding of what we're trying to do, how we're doing it, and how well it's going, and what information we're collecting, what information we're not collecting, and how we're going to be sharing the information and in what format. So clarifying this at the outset is very important. And it can also be a great opportunity to bring people into the fold who may be resistant to your effort, who are uncertain or not on board with the evaluation. Not only can those people give you a very useful perspective, but if you kind of wrap them in early into the process, they're also less likely to cast doubt on what is found later. The next thing you need to do is describe your program. And what we've got up here is a picture of a logic model. And you probably have seen or heard about logic models before. If not, they're a really great tool, and this is one example. But a logic model is a visual depiction of all of the inputs, outputs, and outcomes of your program. And this gives you a nice model for how to think about that. So it forces you, if you do a logic model, to kind of sit down and write out, well, what needs are we addressing? What are we investing? What are we doing and with whom? And what are we hoping will happen? And to kind of draw the connections between those things. And when you do this kind of an effort, it's often leads to very interesting discussions between people who might have different ideas about what we're doing and why, or how it's supposed to be effective. But this is also a great opportunity to generate evaluation questions, which is the next slide. So you need to know what you're trying to find out. And this is probably the second most important part of an evaluation step, is you need to develop a guiding framework for what you're going to be doing and what you're going to be trying to find out. And the evaluation questions are important because everything flows from there. You could have an evaluation go in 100 different directions, and that'll depend upon what you're trying to find out. So you need to know who needs to know what, why, when, and in what format. And at the end of the day, the two biggest questions are, did we do what we said we'd do, and did it make a difference for anybody? The big five, as we like to call them, are common and very helpful to orienting an evaluation, and these are a bit more specific, but they're still quite broad. What are we doing to or with whom? How well are we doing it? Is anyone better off? Is there any evidence that we contributed or caused any changes that we've seen? And then what's the role of context? Because all of these programs often operate in the context that needs to be acknowledged. So you need to decide upon your questions.
The next thing that you have to do is find some data or information to try and answer those questions. So there are two main types of data. Qualitative data, which is usually descriptions, and so this could involve interviews or focus groups with folks or document reviews, those types of things. And then you've got quantitative data, which is all of your numbers, all your hard data, as it's sometimes called. So this might be, what you collect through reports, or if you do surveys, or you might pull them from existing databases. It's also important to note that you usually don't, most often it's beneficial to include both if you can. So if you've got some quantitative data, that might tell part of the story, but then you can probably supplement it with some qualitative data from some folks, which is a mixed methods design. Here are a number of sources of evaluation data. I'm not going to go through all of them, but generally people, records that you might have, surveys, follow-up information that you might get from folks, or specially designed instruments, a lot of different things. So then the next thing, once you find all of your data, you need to figure out what you do with it. So these are some different types of analyses that you might do. You might want to describe the population that you're serving. You might want to compare different groups in terms of if somebody got the program versus somebody who did not receive the program, what were their differences in their outcomes. And you might want to use multiple sources and ways of analyzing data to kind of strengthen your findings and your conclusions. And then the next step is, after you have analyzed the data, you want to share it. You want to make it as understandable as possible to the folks who really need it. This will really depend on the audience that you're trying to communicate to, whether you're trying to go, to legislators to justify continuation of the program, or whether you are, whether it's a grant report that you have to submit to your funders, those types of things. So it will really vary, but you want to portray the data visually if possible, and it will also vary on, the nature of the data that you've got. Also, get creative. I know that infographics are really in right now. I would encourage you. There are some free websites that you can build infographics on that are great, and I think that they're very engaging for folks receiving that data. There's also data stories that I've seen on web pages that kind of give a little bit of a narrative with some interactivity, and then advocacy tools are important too. And I'm going to show you one quick example of a dashboard that we have put together at REACH using data from the KIPP survey that I mentioned earlier that could be kind of thought of as a needs assessment, or you could also use it as an evaluation. So this is our data dashboard, and I'll show you the numbers do change, and it's cool. But this gives a snapshot of what is going on, what the data say. Substance use is going down among the students. This gives the number of students who are bullied and who attempted suicide. So I just wanted to show you a quick example of an engaging and pretty way to show a lot of data on one page.
All right, so we are aware that there's a wide variety of familiarity with program evaluation, probably in the audience, and some of you may have never entered into this world. Others of you may be very familiar. This is kind of an Evaluation 101 presentation, so we did want to just give you a quick tips on how to start an evaluation process now if you are curious about something happening within your program and want to learn more, and just give you a few quick simple steps with an example of what we mean. So if you're interested in starting to evaluate now, I think the first thing you actually want to do is do a logic model, which we showed you earlier. Just kind of write down a visual description of your project or your program so you kind of have an idea of what you're putting in, what you're doing, and what you hope to happen. And then, you just need to identify 2 or 3 questions that you want to know the answer to about your program. And then you want to kind of go and look and see, do we have actually any data already available that can help to answer one or more of these questions, and do we have access to it? Oftentimes, there are data that exist within a system or a program, and all it takes is going to look or going to talk to that one person who's really good with Excel, or going to talk to the receptionist who collects information that you didn't even know she collected, or any number of things like that, and just find out if there's information currently available that you can use. If not, okay, you can create a simple way to collect one or more pieces of information to answer your question. So we were aware that some of you are coming from health departments that are on the call, and so we thought we'd give one quick example of a smoking cessation program. So maybe you are a health department and you're operating a smoking cessation class, and maybe you want to know what percentage of people are completing our program, and does providing a nicotine replacement therapy, like as in a patch, help people complete the program. So if you don't have any data available, one thing you could do is to create a sign-in sheet where you can have folks sign in for every class, and then find somebody who knows how to use Excel or do it yourself and kind of log participation over the course of the meetings, and you can get a sense of how many people are actually attending and completing. And then you can also add in a piece of data that adds in the variable, did this person receive nicotine replacement or not? And then look at that all together to give you a little bit of an idea of what's our completion rate, and does there seem to be any impact of providing a nicotine replacement therapy element or not. And so that's one quick example.
Okay, so now we have a little bit of time for questions. So if you've got any questions, please type them into the chat box and we will address them. We did get a few ahead of time. So the first one we wanted to talk about was about developing reliable evaluation instruments and how to better evaluate service barriers and successes to modify programs more accurately.
Oh, that's a great question. And it's got a couple of parts and pieces to it, so we'll try to quickly answer that question. So in terms of developing reliable evaluation instruments, we'll take that part first. Most of the time, I think people are referring to a survey or a questionnaire probably when they think about that, so we're going to make that assumption as well. And so again, like we said before, identify the information you really want to know. And when it comes to a survey or a questionnaire, you want to try to get as specific as you can. One of the common things that can go wrong with a survey or a questionnaire is you ask kind of double-barreled questions where you're really asking more than one thing at a time, or your questions are too vague. So try to get as specific as you can with your items, and then resist the urge to collect a lot of information. Sometimes this can happen quite easily when you are taking on the effort, but really you want to resist the urge, and you only want to collect information that you're actually going to use or make use of. And then I think it's really important to think about, once you kind of have a draft version, what are all the ways somebody might interpret or misinterpret the questions that we've put down here? And then pilot test it with a few people and get some feedback to see if are we actually getting the information that we wanted, and if not, you can make changes. Now, there are more formal ways to establish reliability and validity of instruments, but those are more complicated, and you probably do need an external evaluator to do that. But this is only important if you're going to become part of a research study, for example, where you need a validated instrument, or if you're going to use the information to make very significant and impactful decisions about your service population, or if you need to validate your instrument for some other purpose. In terms of the second part, which was how to better evaluate service barriers and successes to modify the program, a great way here is to do some qualitative data gathering, maybe through a focus group with a sample of your service recipients, where you kind of ask them these questions and use the information to have a better understanding of barriers and facilitators to success. You could also look to see if you have any administrative data available for any patterns or themes that emerge. So for example, you might choose to look at your participation by zip code or geographic area and to see if that particular geographic area is more or less represented in your population, or if they have more missed appointments, for example. Looks like we have 2 minutes.
Yes.
All right.
So we have also included, and you will get these slides, some additional resources for you on evaluation and our references for this presentation. So here is our contact information. We're happy for you to email us or call us with follow-up questions. So we appreciate your time. And Rochelle, we will turn it back over to you to close us out.
Thanks, Teresa, so much. And I mean, there's lots of details, but you have to get started. Look at the data that you have. You may find things that are important to your work and be able to improve your program. So get started on evaluation. Here's the website, healthy-ky.org, the events tab. You'll find the upcoming schedule for our Health for a Change series. Again, we have a great lineup. Glad you will join us for these free events, some around the state and some via webinar just like today. Don't forget to register for both, because that will go to the wait list very soon if you're interested in joining us at the 2018 Howard L. Bose Memorial Health Policy Forum. I tweet out of Kentucky Health Facts, the data website kentuckyhealthfacts.org that I mentioned at the top of this webinar is there. And finally, this afternoon, I'll send you a link to the post-event survey. Please take a moment, give us your feedback, tell us what you thought about the event, and in that email will also be a link to today's slide deck. Again, thanks to our presenters, Ben and Teresa from Reach Evaluation, for sharing all of their knowledge and experience with us so that we can get us started on learning more about evaluation, improving our programs, and planning for success. Thanks, everyone, for joining us today. I hope you have a great afternoon.
Thanks.